Hello guys, welcome to Dr. Science. So today our topic is about atrophic rhinitis. So in this topic I'll be mainly talk about the definition of atrophic rhinitis, what are the clinical features of this patient, what is the treatment of choice for this patient. In the treatment part I would like to talk about the Young's procedure. So let's start about what is meant by atrophic rhinitis. Atrophic rhinitis is nothing but a condition in which there is progressive degeneration of mucosa and bone of the sinuses, okay, or the turbinates. So let's draw a small diagram here. Suppose this is the nose, and in the nose we have the midline nasal septum. Usually we have three turbinates. One is the superior turbinate, one is the middle turbinate, and one is the inferior turbinate. These turbinates are made up of the mucosa layer. This red color thing here is the mucosa, and inside the mucosa we have the bone. Now together they make up the turbinate. Okay, turbinates are nothing but a mixture of mucosa and bone. These are called as your turbinate. Now if these turbinates are progressively degenerated or getting atrophied due to diseases, that condition is called as your atrophic rhinitis. So atrophic rhinitis is nothing but a condition where there is progressive loss of the mucosa and the bone, which are making up your turbinate. Okay, now not only that, we have to understand the function of turbinates. Okay, once again let's draw the diagram here. This is the external nose, and here we have the midline nasal septum. We have the normal side. Imagine this is the normal side and this is the abnormal side. Okay, first we will understand what is happening on the normal side. Okay, so here is one turbinate. Okay, so what is the function of this turbinate? The function is to maintain medium airflow in nose. Okay, its function is to maintain medium airflow in our nose. Suppose example, hypothetically speaking, we are taking 100% of oxygen. Okay, suppose we are taking 100% of oxygen. Out of this 100%, only 50% is reaching your nose, the internal nose, and thus it is helping to prevent the dryness of mucosa. Okay, imagine like if you are taking a lots of air, you can see in summer due to the hot air density, we are taking a lot of air into our nose. So what will happen? Obviously, due to the hot air, our nose will get dried up, right? So these turbinates are acting like a buffer and preventing the dryness of mucosa. Okay, now we will take a look at the abnormal side. In the abnormal side, as you can see here, the turbinates are atrophied. Okay, the turbinates are atrophied. So what will happen in these patients? Suppose these patients are taking 100% of oxygen. Imagine they are taking a lot of oxygen or air. 100% is reaching the nasal, the internal part of the nose. So obviously this will lead to dryness. The internal nose get completely dried up. When it is completely dried up, there will be formations of crusts. Crusts are nothing but your mucus plugs. Mucus plugs are called as your crusts, which will develop if there is dryness of your nose. Okay, so once again, We'll draw a simple diagram. So in atrophic rhinitis, the turbinates are getting atrophied, due to which a lot of air is going into the nose, and this will cause dryness of the nose, and eventually formation of crust or mucus plugs will take place. Not only that, we can see the nose is widened due to this atrophied turbinate. The nose is a little bit wide, or there is a roomy nose. We call it as a roomy nose. Okay. Now what are the clinical features of this patient? You will see. What are the clinical features of these patients? First, there will be nasal obstruction. I already told you, due to formation of crust, there will be nasal obstruction, right? The crust or the mucus plug will obstruct the nasal cavity. This is called as your nasal obstruction. What is the second thing which is very important? It is called as your merciful anosmia. Now what is meant by this merciful anosmia? I already told you that patient is having nasal obstruction, or there are a lot of crust due to which bad smell is coming from the patient. Okay, and the neighbors can smell him. This bad smell, the neighbors can smell him, and they don't want to make friendship with him. Okay, but unfortunately, due to the nasal obstruction the patient is having, due to the formation of crust, he is having a nasal obstruction, right? Due to which he cannot smell himself. That's why he is thinking like no bad smell is coming from me. Okay, that is called as your merciful anosmia. Okay, so that were the two important clinical features of this patient. One is the merciful anosmia, the second thing is nasal obstruction. Now what are the causes of atrophic rhinitis? Okay, first one is Klebsiella oziana. Now this Klebsiella oziana bacteria, I already told you that the turbinate is made up of the mucosa, right? Klebsiella oziana will eat up the mucosa part of the turbinate. This mucosa part is getting attacked by the Klebsiella oziana bacteria. The second one is vitamin D deficiency. Now vitamin D deficiency can lead to hypocalcemia. Now calcium is needed for bone development, right? So eventually the bony part which is present in the turbinate will get degraded. So hypocalcemia can affect the bone of the turbinate, and this will also lead to atrophic rhinitis. Finally, the third one is estrogen deficiency, which is commonly seen in elderly females. Estrogen deficiency can cause hypocalcemia. Okay, and this will lead to bone degradation in the turbinate. Okay, this can also lead to the atrophic rhinitis. And final is autoimmunity. The exact pathogenesis is not known here, so the fourth cause is just autoimmunity. Now what is the treatment in these patients? In the treatment part, we will do nasal irrigation. With sodium chloride solution. Now what is meant by this? I already told you that in the nose these persons are developing the mucus plugs or the crust. Okay, these are the crusts. So what we will do with a syringe, okay, this syringe is filled up with sodium chloride solution, and we will flush this crust out. This is called as your nasal irrigation. It's like spraying this water inside your nose. That is called as your nasal irrigation. After nasal irrigation, we usually perform the Young's procedure. Now what is this Young's procedure? I'll just explain it here. Please draw this. This is the nose, and here we have the nasal septum. So in Young's procedure, what we do is we suture the external opening of the nose. Suture the external opening of nose. Okay, why we are doing this? Because we are taking a lots of air in, and this is leading to dryness here. This is leading to dryness of the internal nose. So what we will do, we will suture the external opening of the nose for 6 months. So in 6 months this dried part is going to heal. Okay, it will heal itself because the dry air is not coming into that nose. Okay, that is called as your Young's procedure. But usually we will not prefer Young's procedure, because if we tell the patient that we are going to close your nose for 6 months, he will not accept it, right? So in Young's procedure we were completely closing external opening of nose for 6 months. Okay, whereas in case of modified Young's procedure, we will do a partial closure of external opening of nose permanently. This is done permanently. Don't worry, we will draw the diagram here. So this is the nose, and this is the midline nasal septum. So what we are doing is, suppose this was the turbinate. So what we are doing here is we are partially closing. As you can see, we are partially closing the external opening of nose, which is done permanently. Okay, now this partially, why we are doing this partial closure of the external opening of nose? As you can see, it is acting similar to a turbinate, right? Instead of allowing all the air, it will allow only some of the air to enter into the nasal cavity, which is medium airflow is coming into the nose. Okay, thus in modified Young's procedure we usually prefer partial closure of the nose, which is done permanently. Okay, we will suture it permanently, and which will act as a turbinate. Okay, so that was about atrophic rhinitis. Thank you guys.